Thursday morning, July 15th, 8:14. It'll be hot and humid and a chance for afternoon showers. Dr. B joins us, Dr. Brent Wallis, our friend, Chief Medical Officer of People's Health. Talk about some senior health. Hey, Dr. B, how you been?
Hey, Tommy, I've been good. How about you?
I'm okay. I hope you've been spending some pool time, have you?
Yeah, I've been trying to stay in the water. It's been so hot, although all that rain.
Yeah. It's a hell of a thing, isn't it? It's raining, but yet because of lightning, you can't go outside in a pool, and it's not about getting wet. It's about the doggone lightning.
Yeah.
Let's talk about diabetes awareness. According to the American Diabetes Association, there are approximately 500,000 people in Louisiana with diabetes, and 113,000 have no idea that they have it. And that really is kind of chilling if you think about it. Is this because they don't actually know what to look for? Well, Dr. Brent Wallis from People's Health, is going to join us with some important information about this very serious condition. And, Doc, I guess the first place to start is what is diabetes?
Yeah, that's a very good place to start. Diabetes, like you said, it's very, very common. It's a chronic condition we see really daily in clinic, and it's identified by having too much sugar in your blood. But there's actually two different types of diabetes. Type 1, which is a little less common, is where the body doesn't make any insulin whatsoever, and it's typically found in younger patients. Type 2, which is much more common and what we see daily in a lot of adults that we treat, is where the body actually doesn't make enough insulin, or the insulin it makes can't be used properly. And that insulin is so important because it's what allows your body to use the sugar that you get from carbohydrates and foods that you eat to really run your body. And type 2 diabetes, the more common type, really can run in families, and the biggest risk factor is actually being overweight. The scary part about it is, while it can have symptoms, a lot of times it really has no symptoms at all, so it may go completely undiagnosed for a long period of time.
Complications from diabetes, and why is it so important that you manage it?
Yeah, I mean, it's critical to identify and then make sure you manage it well, because the consequence of diabetes is really, it's vascular. So what I mean by that is you've got both small and large blood vessels in your body, and diabetes attacks those blood vessels and can cause damage. And in the small blood vessels, that can cause problems with your nerves or your kidneys or your eyes. It can cause problems with the red enables you to see. And then those large blood vessels are the things that carry blood to your heart and to your brain. So if you have problems with those, you can have cardiovascular disease, things like heart attack and heart failure, or even a stroke.
I don't want to go to medical school every day, but not every day. I don't want to go to medical school today, but why does it affect that, Doc? I would think like it would be something, I don't know, not that is not what diabetes would affect, is what I'm trying to say.
Yeah, it has to do, it's pretty complex, but essentially the high levels of blood sugar actually cause damage to the vessel walls, and that's what can actually lead to all of these problems.
Wow. What are some of the symptoms? How would I know if I have diabetes or think I have it?
Well, there definitely are some symptoms to look for if you have them. Increased hunger is a big one, because your body can't really use the sugar that it has. You may feel hungry a lot of the time. And then you can also get increased urination. The high sugar in your blood has to be filtered out, and it's filtered through the urine, which leads to increased urination and consequently sometimes increased thirst as well. And then a lot of people with diabetes may just have a simple symptom of fatigue. They just feel tired all of the time. One of the things I see most common, though, is people who have sores or cuts that really are slow to heal. That's some of those vascular problems. Blurry vision is always a concern and can be related to diabetes. And then one of the most common first symptoms we see sometimes is a tingling or a numbness, especially in your hands or feet, and that's that nerve damage. So, like I said, there may be no symptoms whatsoever, or one thing we do a lot is we kind of explain away our symptoms. So it's, like we said, it's super hot out right now. So you may say, oh, I'm just thirsty because it's so hot, but it could be something else going on. So that's why it's so important to talk with your doctor and get your checkups done.
And I know I see people working on with the big gallon jugs of water and chugging it down. Naturally, I guess you're going to have to get rid of it at some point, but that's not what you're talking about at all, right?
Yeah, not at all. I mean, it's important to stay hydrated, especially while you're outside in the summer. But if you're drinking a whole bunch of water pretty much all the time, even after you go indoors, that could be something else going on that you need to get checked out.
Let's take a break. When we come back, we'll talk about if there are no symptoms, how do you know you have it? We're talking to Dr. B, Dr. Brent Wallis. Good to have him on, Chief Medical Officer of People's Health. Talking about some senior health, but really a topic that affects a lot more than seniors, and that is type 1 and type 2 diabetes. 8:20, time for traffic now on WWL. Morning's flying by, 8:24 and a half. Good to have Dr. B on again. Dr. Brent Wallis, Chief Medical Officer of People's Health, talking about senior health overall, but really, Doc, I guess the file beneath the senior file would be overall health as we talk about diabetes, because it affects a lot more people than just seniors. If there are no symptoms, and we mentioned that earlier, how do you know you have it?
Yeah, I mean, I say this all the time. That's why it's so important to make sure that you go to see your doctor. Get your checkups done, and tell your doctor about any health history you've got, or possible risk factors. Really the recommendation is that any adult that's overweight should be screened for diabetes after age 35. And that's something we can do in the office with a simple blood test, and really tell you right away if we've got a concern. And family history plays such a big role in diabetes type 2 in particular. So if you've got a relative with diabetes, you absolutely should be screened. And there's a couple of other groups that have a higher prevalence of diabetes, and that includes African Americans and actually Hispanic Americans as well as some others. So, the thing to also keep in mind is when you get that screening done, you might be diagnosed with something called pre-diabetes, which is when your blood sugar is not normal. It's a little bit higher, but it's lower than the levels that we use to say that you have true diabetes.
Elephant in the room. A lot of people, I think, Doc, and it's not right, but they don't go because they don't want to know. And that's no way to address this, I presume.
Yeah, no, I mean, that's a big problem, kind of head in the sand, but that's not what works for diabetes, because a lot of these complications can be prevented. So you really want to know about it so that you can actually do something about it.
But that's true, isn't it, about patients not wanting to know?
Oh, yeah, it's very, very common. And, and a lot of times they don't want to tell us certain symptoms they may be having when they come into the office, but you really should be honest. They don't want you to
find it either, right?
Yeah, definitely.
Yeah, I know. I've been there, done that. Can you elaborate, Doc, on prediabetes, and does it mean you will get diabetes?
Yeah, prediabetes is actually, it's kind of interesting. It's a condition that is a strong risk factor for developing future diabetes, but it's not set in stone. So diabetes itself is only treatable. We don't have a cure yet, but prediabetes we actually can completely cure. And so that's why it's so important to have those annual checkups, because if we identify prediabetes, we can actually enact a plan that could actually catch it early enough to completely prevent you from going on to developing diabetes and any of those complications.
So right there is your reason to be tested, because if you catch it in the pre-diabetes state, you can prevent somebody, presuming hopefully they go along with all the guidelines, from getting it. But if they wait and they have diabetes, well, that's it. That's too late. They live with this, right?
Yeah, definitely. You want to head it off completely, because once you've been diagnosed, there's a whole series of things that you may have to go through, taking medications, a lot of lifestyle modifications. You'd want to head those off if you possibly could.
What kind of lifestyle modifications are recommended?
Well, we say this for a lot of diseases, but it's super critical in diabetes. Eating a healthy, well-balanced diet is extremely important, and that can be hard here in Louisiana. Summertime, we love our snowballs. We like our po' boys, but really trying to reduce the number of calories you're taking in and the number of carbohydrates. Eating things that are more lean is really important. And then really staying active and exercising so that you can maintain a healthy weight. Weight plays a huge role in prediabetes and diabetes. And so if you can keep your weight at a healthy level, you're less likely to have a problem. And like we said, that can really prevent a lot of these complications, or if you do have diabetes, can at least delay some of the complications, sometimes for years. So research really proves that good diabetes control can reduce most of those risks down to practically nothing, but it's really up to you to make sure you're taking care of yourself.
In terms of the supply side of this, the demand side rather, people, because I've known people, doctor, and I'm sure you have too, that have lost limbs and they just can't control their diet. Has there been any advance in terms of medicine that would help people with that?
Yeah, there's definitely a whole lot of medications that we have. Some are actually oral, you take by mouth. Some are injectable. But the advancements have been really dramatic in the past 10 years or so. And if you stick to your regimen, you really can avoid a lot of those tragic complications like amputations and blindness as well.
Bottom line, don't put it off. Get yourself checked. You can visit peopleshealth.com/radio and call 866-687-7335. And you can follow People's Health on Facebook, Twitter, or Instagram. Doc, I hope you get a lot of pool time this weekend.
I hope so. Thanks, Tommy. You have a great one.
Stay cool. Good to talk to you again. Dr. Brent Wallis from People's Health.